Migraine is a debilitating disease linked to trigeminal nerve dysfunction. During migraine attacks, calcitonin gene-related peptide, or CGRP, is released by the trigeminal nerve and alters the way the brain processes neural inputs. Plasma levels of CGRP have been shown to increase during a migraine attack, and exogenous administration of CGRP in individuals with a history of migraine triggered typical attacks. When an action potential propagates along the trigeminal nerve, CGRP is released from both central and peripheral terminals, including release from projecting nerve fibers into the trigeminal vasculature. CGRP then binds to receptors and causes dysfunctional signaling that is thought to play a role in a migraine attack, with its debilitating symptoms and disrupted daily activities. Let's explore some effects of CGRP binding to its receptors: inflammation, artery dilation, and pain. Preclinical studies have shown that CGRP binds to receptors on meningeal mast cells and triggers an inflammatory cascade that makes neurons hyperexcitable. CGRP also binds to receptors on smooth muscle cells within artery walls, which causes dilation of intracranial arteries. The trigeminovascular system is innervated by a rich plexus of nociceptive nerve fibers that originate in the trigeminal ganglion. CGRP binding to receptors in the brainstem increases the firing of postsynaptic neurons, which results in exaggerated pain signals being sent to the brain. Two classes of medications target the role of CGRP in migraine: the CGRP receptor antagonists and the monoclonal antibodies specific for CGRP pathways. Rimegepant is a small molecule CGRP receptor antagonist that selectively binds with a high affinity to the CGRP receptor. Rimegepant blocks CGRP from binding to the receptor. This blocks the effects of CGRP released by the trigeminal nerve. The relationship between the pharmacodynamic effects of CGRP blockage and the clinical effects of rimegepant is undetermined. Rimegepant is available as an orally disintegrating tablet dose form with high oral bioavailability and an 11-hour half-life. Rimegepant is indicated for the acute treatment of migraine with or without aura in adults, and the preventive treatment of episodic migraine in adults with at least 4 migraine attacks per month.